Hi, I'm Maureen Rackham. I live in the Cheadle-Hulme area of Stockport, and I'm here today to tell you about my experiences with the NHS and my cancer diagnosis. I did the screening test that come through the post. Admittedly, I hadn't done the previous test, but I'd done my first test, which was clear. So it was 4 years since I did my first test. 2 years previous to this last test, my test had come through the letterbox. My husband did his, but for some reason, like you do, mine just got put to one side and thought, oh, I'll do that tomorrow, and I didn't do it. But when this last test came through the post, I decided that yes, I should do it, and I did. The test results came back abnormal, and I did a further test which was also abnormal, and I was booked for a colonoscopy. The colonoscopy was not unpleasant, and I felt quite relaxed, but the doctor performing it just told me there's a tumour in your bowel and it's big. And then I came unrelaxed and went totally numb, because that wasn't the news I was expecting. My husband had dropped me off thinking that I would be okay and he'd come back and collect me, and that we would return in a couple of weeks for the results. Didn't expect to be told there and then, when I was lay on the table, that I had cancer. And the fact that they then left me in a room on my own until my husband returned to pick me up, which was a good 40 minutes. And I just felt totally numb and detached, I think. To say that he had no bedside manner would be a way of putting it. He was very cold, very just correct, and just talking as if it was a non-event. The nurse just gripped my hand, but he just didn't do anything. So he said, are you on your own? And I said, no, my husband's coming back for me. And he said, well, we'll talk to you both when he comes back. But to me, he should have done it the other way around. He should have waited and told us when my husband was with me. My choice of hospital was Stepping Hill. The operation commenced very quickly. I was seen to within 3 to 4 weeks. No complaints about the surgeon, the way it was dealt with, the aftercare on B6, the nurses were fine, and I recuperated quite well. My only complaint I would have was my time spent in HDU between my operation and being transferred to the general ward, and that was, in my opinion, horrific. I had a morphine pump, which I was told just to press when I needed it. I was told that I couldn't overdose on it. I had a very bad reaction to the morphine. I was hallucinating. I'd never experienced anything like that. And the nurse who was in charge during the night was very unhelpful, very dismissive, told me he was looking after 3 other sick patients. And I felt, well, what am I? I'm sick, and the morphine obviously was distorting my reactions to everything, and it's just left me with a horrific aftermath of that. But from the HDU to the ordinary ward and my ongoing chemotherapy that I had after on the Ogbimore unit, I couldn't praise it enough, because the nurses were excellent and their care and thoughtfulness was just wonderful. So my only bad point is the HDU care, and perhaps they're not cancer carers, I don't know. I got a sense that they shut the curtains round me and they were brewing up, and one of the nurses was copying CDs on a player and they were chatting, so they weren't doing their one-to-one nursing. Certainly this male nurse wasn't. And I thought, well, you're doing that, and they're sort of dismissing me. And, you know, I'm saying some of it could have been the morphine deluding me a little bit, but that's the way I felt. The daytimes were fine, but certainly the nights were awful. I had the all clear a year last Christmas, and I'm on 6-month MRI scans, and I just had one last month which was all clear. So what I'd like to say to anybody that's listening, that don't ignore your bowel screening test when it comes through the letterbox. I'm here as proof that it works. If I hadn't have done this last test, I probably would not have been here to tell you this. I'd advise anybody just to do it. You don't have to have symptoms. You can feel 100% fine and think, I'll stick it in the drawer, I'll do it later. Just do it, because I'm proof that doing it saved my life.